Good morning, all. Today I'll be talking about VTE diagnosis and treatment. So, whenever we suspect a patient having DVT, we usually proceed with doing a DVT well score. So, these are the components of it, and the points are shown on the right. So, it says if someone has active cancer where he's having an active treatment ongoing within 6 months, or on palliative, he scores 1. If there is paralysis, paresis, or recent plaster immobilization of lower limbs, he scores again 1. If recently bedridden for 3 days or more, or major surgery within 12 weeks requiring GA or local anesthetic, it's 1. Localized tenderness along distribution of deep vein system, he scores 1 again. If the entire leg is swollen, like it should be one leg, then it's 1 point. If the calf swelling is 3 centimeter greater than the other normal leg, then again 1 point. If pitting edema confined to one leg where the patient has symptoms, it's 1 again. If there is collateral superficial veins, 1 again. Previously documented DVT, that's the past history, is 1. If an alternative diagnosis is as likely as a DVT, then he scores a -2. So from this, if the patient has something like 2 points or more, then a DVT is likely. If it's 1 point or less, then there's less chance for DVT. But we should proceed as the NICE guideline says. So we'll go first with what's likely going to happen in a patient who's scoring greater than 2 points. So if someone is having a DVT well score of greater than 2, greater than or equal to 2, then we should immediately do a proximal ultrasound within 4 hours. But in most cases, it's not possible. We should send the patient to have a D-dimer done and start him on interim anticoagulation. That is usually with DOAC. And if the scan comes back positive, then a diagnosis of DVT is continued, and we continue the treatment, like continue the DOAC. So if the same patient, the D-dimer is positive, but the scan is negative, then we should do a D-dimer if it's not already done. And if the D-dimer is positive but scan is negative, we should stop the interim prophylactic anticoagulation and repeat scan in 6 to 8 days. And if that turns out to be positive, treat like a DVT. If that's negative, then stop all treatment. Think about other diagnosis. So if the patient is scoring less than or equal to 1 point, immediately do a D-dimer within 4 hours, or we can start him on interim anticoagulation while awaiting results. And if the D-dimer is positive, do an ultrasound. If it's negative, stop interim anticoagulation and think about other diagnoses. So if the D-dimer is positive and the ultrasound is positive or negative, just proceed like I've said before. If it's positive, diagnose DVT. If it's negative and the D-dimer is positive, stop the anticoagulation, wait for 6 to 8 days, then repeat leg ultrasound. And if that's still positive, treat like DVT. If that's still negative, think of other causes. It's as simple as that. Thank you.